As Nigeria continues to drive towards universal health coverage, lawmakers are calling for stronger legislative actions to strengthen the nation's health system through innovation, accountability, and technology. This was the focus of the 6th Annual Legislative Summit on Health, which brought together senators, members of state assemblies, development partners, and health experts in Abuja. In a communique issued at the end of the summit made key recommendations and commitments, including open-door policies for feedbacks on data governance and health financing laws, promoting local production of medical products to reduce import dependency and medical tourism, digitalization efforts to align with professional incentives and training for health workers, among others recommendations.
The summit finally resolves that 1. Appropriation of funds without release can hinder the accomplishment of universal health coverage in Nigeria. 2. Climate resilience is a priority investment to protect community health towards overturning up to 21% of disease burdens attributed to climate change. 3. Private sector participation is pivotal to expanding digital health science services. Therefore, private sector providers in clinic, laboratories, and diagnostic centers should be integrated into the national health information systems. Fourthly, there should be proper oversight of the health sector to ensure effective and consensuous stewardship of scarce resources. Also, phased solarization by the federal government and subsidized tariffs are important to sustain energy strategies to power health facilities. The summit also resolved that policies are required to streamline the client's journey into Nigeria's health systems from primary health care to tertiary levels. Ongoing constitutional review presents a rare opportunity window for transformative financing policies for healthcare commodities to mitigate the impact of global aid cuts on essential health commodities. And lastly, there is a need to map digital health innovations and create a platform for interoperability and standardization.
The chairman of the Senate Committee on Health, Senator Ipalibo Banigo, stressed that achieving universal health coverage requires a resilient system anchored on legislation, collaboration, and sustainable financing.
Talked about digital tools. Then we talked about energy for health, and then we talked about those things that to ensure that working towards universal health care, what are the gaps in legislation that will foster these processes towards universal health coverage. So we have seen that there are quite a lot of gaps, and that is what we are going to go back and work on as legislators to see how we can develop these bills and to fill these gaps that will propel us and will give governance and structure and legislative framework to ensure that we can cover the gaps towards attaining universal health coverage. Innovative health financing is very key. Why? Because at this time we're trying to develop awareness for domestic health financing because of course, you know, the burnout from the external agencies, and for us we believe that we do have those resources if we legislate well for them.
But also identification of the challenges and opportunities for further improvement, and I think that this is important because legislators at federal level, state level, civil society, but also multilaterals like WHO, UNICEF, UNFPA are sharing the knowledge, sharing the success stories, and also looking at the data behind the recent progress, which allow us actually to identify the opportunities from the legislative perspective, but also from the implementation.
The summit concluded with a unified call to action urging all arms of government, the private sector, and development partners to collaborate in building a digitally empowered, equitable, and resilient health system capable of meeting the needs of every Nigerian.